Hello, this is Richard Torres with part 2 of eye anatomy video. Now we are going to look at 3 eye structures and how each of them is affected by disease. First, we will look at damage to the retina. Diabetic retinopathy affects blood vessels in the light-sensitive tissue called the retina that lines the back of the eye. It is the most common cause of vision loss among people with diabetes and the leading cause of vision impairment and blindness among working age adults. What causes diabetic retinopathy? High blood sugar from diabetes is associated with damage to the tiny blood vessels in the retina, leading to diabetic retinopathy. The retina detects light and converts it to signals sent through the optic nerve to the brain. Diabetic retinopathy can cause blood vessels in the retina to leak fluid or hemorrhage, distorting the vision. In its most advanced stage, new abnormal blood vessels increase in number on the surface of the retina, which can lead to scarring and cell loss in the retina. Who is at risk for diabetic retinopathy? People with all types of diabetes are at risk for diabetic retinopathy. Risk increases the longer a person has diabetes. Between 40 and 45% of Americans diagnosed with diabetes have some stage of diabetic retinopathy, although only about half are aware of it. Prevention and treatment. How can people with diabetes protect their vision? Vision loss to diabetic retinopathy is sometimes irreversible. However, early detection and treatment can reduce the risk of blindness by 95%. Because diabetic retinopathy often lacks early symptoms, people with diabetes should get a comprehensive dilated eye exam at least once a year. People with diabetic retinopathy may need eye exams much more frequently. Now we will look at a disease that affects the optic nerve. Glaucoma is a condition that causes damage to your eye's optic nerve and gets worse over time. It is often associated with a buildup of pressure inside the eye. The increased pressure, called intraocular pressure, can damage the optic nerve, which transmits images to the brain. If damage to the optic nerve from high eye pressure continues, glaucoma will cause permanent loss of vision. Without treatment, glaucoma can cause total permanent blindness within a few years. Because most people with glaucoma have no early symptoms or pain from this increased pressure, it is important to see your doctor regularly so that glaucoma can be diagnosed and treated before long-term visual loss occurs. Why does pressure rise in the eye to cause glaucoma? Glaucoma usually occurs when pressure in your eye increases. This can happen when eye fluid isn't circulating normally in the front part of the eye. Normally, this fluid, called aqueous humor, flows out of the eye through a mesh-like channel. If this channel becomes blocked, fluid builds up, causing glaucoma. The direct cause of this blockage is unknown, but doctors do know that it can be inherited. Less common causes of glaucoma include a blunt or chemical injury to the eye, severe eye infection, blockage of blood vessels in the eye, inflammatory conditions of the eye, and occasionally eye surgery to correct other conditions. Glaucoma usually occurs in both eyes, but it may involve each eye to a different extent. The main objective in treating glaucoma is to lower intraocular pressure in the eye. A lower intraocular pressure can reduce damage to the optic nerve and save any remaining vision. If you are over age 40 and have a family history of glaucoma, you should have a complete eye exam with an eye doctor every 1 to 2 years. If you have health problems such as diabetes or family history of glaucoma, or at risk for other eye diseases, you may need to visit your doctor more frequently. Finally, we will discuss a condition that affects the lens of the eyes. A cataract is a clouding of the lens in the eye that affects vision. Most cataracts are related to aging. Cataracts are very common in older people. By age 80, more than half of all Americans either have a cataract or have had cataract surgery. A cataract can occur in either or both eyes. It cannot spread from one eye to the other. As discussed in the earlier video, the lens is a clear part of the eye that helps to focus light or an image on the retina. The retina is the light-sensitive tissue in the back of the eye. In a normal eye, light passes through the transparent lens of the retina. Once it reaches the retina, light is changed into nerve signals that are sent to the brain. The lens must be clear for the retina to receive a sharp image. If the lens is cloudy from a cataract, the image you see will be blurred. What causes cataracts? The lens lies behind the iris and the pupil. It works much like a camera lens. It focuses light onto the retina at the back of the eye where an image is recorded. The lens also adjusts the eye's focus, letting us see things clearly both up close and far away. The lens is made up mostly of water and protein. The protein is arranged in a precise way that keeps the lens clear and lets light pass through it. But as we age, some of the protein may clump together and start to cloud a small area of the lens. This is a cataract. Over time, the cataract may grow larger and cloud more of the lens, making it harder to see. How is a cataract treated? The symptoms of early cataract may be improved with new eyeglasses, brighter lighting, anti-glare sunglasses, or magnifying lenses. If these measures do not help, surgery is the only effective treatment. Surgery involves removing the cloudy lens and replacing it with an artificial lens. This completes part 2 of this eye anatomy video. I hope you have enjoyed it. I have certainly learned a lot in developing the videos. Thank you and goodbye.